Hey friends, welcome back to the Fertility Confidence Podcast. I wanted to do things, I feel like I start every episode with I'm going to do things a little differently. I had an idea to talk about 3 non-pill fertility recommendations. The reason being, we are so quick, right, to hop on Google and look at what can I take, what's good for X, and there's always a couple of lifestyle tips, but we're like, ooh, there's a bottle of something I can buy. That's the magic ticket. That's what's going to change everything for me. And what 2 things I find end up happening. One, you either are the version of that story that ends up on 15 different supplements. You have no idea why you're taking them, what they're for, if they're even right. You don't even remember buying them because you Amazon click add to cart in the middle of the night during a Google binge, right? Or you're the second version of that story that either got so overwhelmed they just stopped taking everything or didn't even know where to start. These are sort of the 2 kind of parallels that we see when clients come in to work with us. So I got to thinking, what are the non-pill things that we can talk about? We have an older episode back from when Fertility Confidence Podcast got launched that was, what's it called? Something like four free things you can start doing to boost your fertility. It's actually a really popular episode still. So you can scroll back. It's number 1 to 5, somewhere in that range. And we talk about things like nutrition changes and lifestyle changes. And so I didn't want to go there again. So I sat down and I said, what are 3 non-pill fertility recommendations that I have been making a lot recently that actually have nothing to do with nutrition, movement, mindfulness, sleep, our 4 core pillars at Fertility Confidence Method. So your brain might be saying, Kelsey, what the heck is left? Right? What on earth are you going to talk about? I really went down this rabbit hole of physical modalities. And it's so funny. And I think this is so timely. And maybe this is why this was coming up for me, but I truly have been recommending these 3 things more than I ever have. And I think a lot of my hesitation prior was I put myself in this box of I only use things that have enough deep quality evidence. I only prescribe protocols that I can whip out multiple scientific peer-reviewed literature articles for and say, this is why. And that's still very important. But I realized that I was also missing out on different ways and capacities to help clients thinking outside of the box by putting myself in this teeny tiny little box. So I've started to spread my wings a little bit, so to speak. And we've really, really been focusing on what are some of the actual physical medicine pieces that we haven't really been talking about with our clients that may offer some support. And at the very least, they're not going to harm. So today I want to share with you the 3 things that we've been talking a lot about with our fertility clients in that sort of realm. And if those feel like they serve you and you try one out, amazing. And if not, that's cool too. Okay. So the first one I feel like should come to no surprise if you follow me over on Instagram or if you are a Fertility Confidence Method member, and that's red light therapy. And it is one on my list where I actually can say, here is some of the research. My hope is that within the next 5 years, we are going to see an abundance of positive reinforced research with red light therapy and fertility. We do have some already. We have more in male factor fertility than female, which is just I feel so common, unfortunately. It's easier to run randomized controlled trials and things like that with being able to test a semen analysis before, during, and after, right? Whereas it's not as simple and easy when for women, we're really testing women going through IVF. So we end up having a difference of research kind of buckets, where sometimes it's just easier to test things in men than it is in women. And red light therapy just seemed, for whatever reason, to be one of those things. But we have two decent studies. One is pretty small, one is not terrible. A Japan study and a Danish study actually looking at what they call severe infertility, which sounds very ominous and scary. But in the Japan study specifically, small, I think there was like 10 or 12 women, like fairly small study, severe infertility. So what they labeled that as is couples who'd been trying, I believe, for 4 years or more, who hadn't had success and who had failed ART, failed assisted reproductive technology. They did red light therapy with these women. I should have pulled it up before I hit record, but I'm always just kind of like fly on the seat of my pants. I have a few minutes to record in a quiet house and we're just going for it. So it's something around 15 to 20 minutes, 3 to 5 times a week for 3 months. And of those women that completed the study, like 60% of them got pregnant. Like, what the heck? Like, this makes no sense, right? You know, if you're sitting there being like, oh my God, I've tried for 4 years and nothing has worked. Like, what an amazing and easy, accessible, at-home treatment. Is it going to solve all of your problems? Maybe not. But what a cool place to start to say, this may be a game changer for me. We see with the male research, it's increasing counts, it's increasing motility, it's improving DNA fragmentation and morphology. Red light therapy, and specifically, so the wavelengths matter, okay? So when we're actually looking at the type of red light that specifically is targeting deep into the mitochondria, which is what we want for improving things like egg quality and sperm quality and inflammation and endometrial health, we actually want near infrared light. So it's like the 820 nanometer, I believe, and I'll correct myself if that's actually not accurate, because again, I did not pull this up before I hit record, and that was silly of me because it's Saturday. My brain's not totally on, but it's fine. So we need to be using a specific type of device. Like a red light bulb you pick up at Home Depot is not what we're talking about. The actual wavelength of the light is crucial for it to be therapeutic. So I have some clients that will go, oh, Kelsey, I have like an infrared sauna and it's red. So that's the same, right? And I'm like, not necessarily. Like, cool, sweating, detoxification, that's really important, but it's not the same thing. So we have tons of options on the market now. It's a very cool, trendy, like biohacking tool. There's specific ways you want to use it. And it's amazing, amazing, amazing what we're seeing with our clients when it comes to egg quality, inflammation, pain management. And then we can like step out of the fertility box, and it helps to boost collagen and reduce wrinkles and improve healing and joint health and adrenal health. Like, the options are quite literally endless. And what I'm telling my FCM clients who are like, oh, it's an investment. It's not the same as like, let's just add some protein to your diet. Like, this is an investment in your health. Okay. They're not cheap. However, what I've been telling my members is, what's going to be really cool is if you decide that this isn't something you're going to continue to do after you're pregnant, which in all honesty, like, you have tons of other uses for it. So you very well could find, that you love it, you enjoy it, it's a perfect part of your self-care practice, and you keep it. But if not, the resale value on these things is likely going to be pretty decent. Like, they have like a 50,000 hour use time, which means they're not going to last forever, but they're going to last a pretty darn long time. And you'll likely be able to sell it to another infertility warrior who's hoping to do the same thing. So we've seen some pretty cool changes with some of our clients. One of our women having had no eggs at retrieval for 2 cycles, both cycles were canceled, implemented red light for 8 weeks prior to her 3rd retrieval, and ended up getting like 6 eggs retrieved. And I think of those 6, 3 fertilized and made it to blast. So like excellent numbers in the grand scheme of things. We've had multiple clients implement this and have and get pregnant without medication. We've also had multiple clients implement this going through the IVF process and having had failed transfers before actually having positive transfers. So clinically, we are definitely seeing benefit. So red light therapy may be something that you want to explore. The second one that we've actually been recommending a little bit more than normal / ever, I feel, is castor oil packs. And again, this was something I was telling a colleague of mine, because I've been using castor oil packs personally, which is probably what had me to start saying, this is so silly. I need to talk about this with my clients more. And in school, so like however many eons ago, we always heard, or at least I did, and maybe some of the any ND grads in my year, if you're listening to this, you can confirm this. But I feel like in school, we were just taught that castor oil packs solve every problem. Castor oil, if anything is wrong with someone, prescribe them a castor oil pack, on top of maybe other things, but everyone just got a castor oil pack and nobody could explain to me why were these good? Can someone just explain to me why this weird, thick, goopy oil is a magic healing tool? But no one could really explain it to me other than increased blood flow. Okay, fine. So I just kind of chalked it up in my brain that castor oil really didn't have a lot of research, specifically in the fertility realm. And it was just this elder ND passed down wisdom, which I'm here for. Okay. There is definitely a time and a place for clinical experience. And like I said, I put myself in this box, this evidence only box. So my elder passed down clinical experience wisdom always took the back seat until I felt like we really needed to think outside the box. And over the last few months, I was like, no, you know what? We can probably pull this out of the box a little bit. So we've been recommending more castor oil packs. Really amazing to reduce inflammation. Again, increase blood flow. So think about thickening lining. There's a lot of clinical stories and antidotes about shrinking fibroids. It's awesome for gut health and constipation. So getting those bowels moving, think movement, right? So often when I was learning about castor oil packs, we often heard you don't want to actually do castor oil packs when you're on your period because that might make blood flow heavier. And we are actually recommending to only do them in your follicular phase, just from a safety perspective. Again, because we don't have any safety data, we aren't using them in that luteal phase. Personally, I think that's just a comfort level for me and for my clients as well, right? So think inflammation and okay, so let's go back to the blood flow piece first, actually, because I never said anything about egg quality. But indirectly, if you are increasing blood flow to your pelvis and blood flow to your ovaries, you are bringing more oxygenation, more nutrients to that area. If there's going to be a better capacity for the body to reduce reactive oxygen species in that area, and therefore there is likely a benefit to egg quality. We also know that the gut plays such a huge role in hormone balancing. If you are someone who struggles with constipation, castor oil packs can be a really good job getting things moving. And specifically constipation where you feel you can go, but it's almost like your colon just can't get everything out. Poops are small. You always still feel like you got a little bit left in the pipeline, that you just have a sluggish, lazy colon. And you're someone who's I've done the things. And why I like actually implementing this, because to go in and do functional gut testing and uncover what's going on in there to really get down to the root cause is also, if we find something, us asking you to stop trying to conceive for 3 to 6 months. The majority of my clients that come and work with me, they're already past the 6-month mark of trying, some past a year, some past 2 years. To say, okay, we can help you, but you can't actually actively conceive for the next 6 months. That's simply not an option on most people's table. Some people, yes, that serves them and that feels right for them. And if you have extensive gut issues, that might be a conversation you need to have. But the approach that we take is, how can we heal the gut and help the gut without using protocols and supplements and things that would mean we can't safely try to get pregnant in this time. That's the approach that I've decided to take. Not everyone might agree with that, and that's fine. That's why not one practitioner is right for everybody, right? You have to find the person that jives with you. And castor oil packs are something that we can put into place to help get that colon moving, to help get that waste out, to help overall decrease inflammation and improve hormone balance indirectly. That isn't keeping you from actually being able to TTC that cycle. So that's another one that like I can't whip out, a laundry stack of research articles, but I can back up that if we're using it appropriately, it's safe and effective to try, and it might actually make you feel really good as well, which is awesome. The third one, which is a little bit out there, but maybe this is because we've been having more women come to us with more fibroids, adhesions, blocked tubes that are, we're trying to, again, find out of the box ways to see how we can support their body in making and allowing them to get pregnant and allowing that to be a possibility for them. And so we've actually started recommending something called a Coregeous ball. And this is a product that I learned from an amazing mentor of mine, Jen Pike. If you haven't heard of her, go and listen to her podcast called The Simplicity Sessions. She has a lot of really amazing, wonderful health research. She's been in the game for a very long time. And I learned about Coregeous balls from her because I do her synced program. So if you haven't heard me talk about cycle syncing and cycle syncing my workouts, it's Jen's synced membership that I started doing like 2 years ago now, and has completely changed the game for me in terms of movement and exercise. And we'll talk about that on a later date. But if you want a little pre-screening to sort of how to move your body in relation to your cycle, we do have some older episodes on cycle syncing, so you can scroll back and give those a listen. But she loves using a Coregeous ball to just, again, help. It's like at-home massage. So oftentimes I'll get asked like, Kelsey, should I do, like mine abdominal massage and things like, is there any benefit to that? And the reality is truly we don't have any concrete research. Are there some clinical anecdotal messages out there? Absolutely. Could we maybe get that benefit for a fraction of the price at home? Yes. And that's where a Coregeous ball comes into play. So we've actually been recommending self-abdominal massage with a Coregeous ball. You can grab one off Amazon pretty decently cheaply, in all honesty, for any of our women who have had confirmed blocked tubes, fibroids, or any sort of like adhesions or uterine abnormalities where like breaking up, or you have had a C-section before. Maybe they've been working with us and it's secondary infertility and they had a C-section, helping to break up some of that scar tissue. It's also really great if you're, again, someone who deals with constipation. And we just talked about with castor oil packs, like getting your bowels moving properly helps indirectly with the laundry list of things we're likely working on to improve your chances of getting pregnant. So is it going to harm? No. Is it going to be the golden ticket? Maybe not. But it's worth a shot if we're dealing with these things, specifically the blocked tubes, because in all honesty, we have like nothing. We have no like that I've seen, at least. If you have a study, please send her my way. But we don't have a lot of research in natural therapies to help unblock tubes. It's one of the sticky kind of parts of like, these are the out of the box things we're going to try and see what happens. If you're not in a mental place or financial place where IVF is available to you, then let's do some things and see like, what are the chances? Can we get whatever's in there to actually like loosen up and come out? Maybe we get it loosened up, you go in for another tubal check and it actually is able to open up. Like, awesome. If there's some scar tissue in there that's just causing a little bit of stickiness and adhesions, can we break that up? If the tubes are inflamed, could all three of these things potentially help? Absolutely. Absolutely. We just don't have the strong clinical data. But this is where we need to make mindful decisions and a proper risk assessment style decision based on you and your beliefs and your health. And this is the kind of newer approach I'm opening ourselves up to and opening my clients up to say, hey, you know what? I can't back this up by the paper that I normally can, but I can feel confident in the safety if we use it in XYZ way. Let's give it a shot. If this fits within your budget, which a gorgeous ball is like $30, you can get free videos on YouTube to figure out how to use it. A castor oil pack is like $40 to $60. The red light therapy, yes, you're making a larger multi-$100 investment likely. So we have a bit of a stepwise pattern here. And this is what I mean when I say at the beginning that like you don't have to do all three of these things. Which one is actually speaking to you more? Which one maybe makes sense for where you're at in your journey? And does it fit within your protocol? As always, with everything, you really should be running this by your care provider to make sure that it is appropriate and safe for you. It's the same conversation that we have with supplements. Not every supplement is right for every single person. You don't do something because I said it's good. You do something because it is legitimately the right step and addition into your protocol based on where you are at in your fertility journey. Okay? Okay. So that's 3 non-pill fertility recommendations that we have been actually doling out in FCM and in our private practice quite a bit in the last couple of months. Hopefully that was helpful for you, and I'll see you guys in the next one.